I'm Dr Anthony Maloof, advising faces and corneal oculoplastic surgery in Sydney, and this video on rinse your nose is basically a high-tech nose pick. Now, I'm not going to show you all the nose pick because it's pretty gross and it'll probably put you off your whatever you want to eat or even destroy your appetite. But the point of this video is to show you that you should rinse your nose, and we need you to rinse your nose, particularly after keyhole watery eye surgery, and I'll show you why. The case I'm going to present is got a lot of basically boogers inside their nose attached to a silicone tube that I use after watery eye surgery. But the simple answer is this: in the end, just rinse your nose twice a day. If you've got any nose problems, rinse it twice a day, and you'll see why. So here we go. This is the person, and this is the inside of the nose. So I'll start the video, and here you see me going in, and there's all the rubbish there inside the nose. It looks terrible. Green mat there, and higher up over where we've operated, there it is there. Huge amount of rubbish there. Basically, you'd call it a booger. And what do? I stick a forceps in there and I pull it all out. In this case, it's attached to a silicone tube because I put the silicone tube in there as part of surgery and I pulled it out. Patients always say, oh, I really tried, but you need to try a bit harder. Here's the rule: you can try really hard and still get some in the nose, but if you don't try, you'll get a whole lot more. Here we go on to the next slide, and I'll show you the next slide. And here we go. Start this, and after I've taken it out, there's the opening of the watery eye. You can see it. She's blinking, and look at the pumping action going on. That's your tear pump, and you can see it just beautifully. I'll play it again. Really nice demonstration of the pump going on. There it is, right there. And that's the opening of the tear drain, exactly as it should. We're going to the next slide, and here you see afterwards that when we do the pumping, after we move the tube, you can see a whole lot of dye here. Look at this green orange dye coming through, showing beautiful tear flow into the nose, and that is a successful keyhole watery eye operation. So thank you for watching. That is a high-tech nose pick. I'm Dr Anthony Maloof, advising faces in corneal oculoplastic surgery in Sydney.